For that primetime special last night, we spoke with Dr. Anthony Fauci about what needs to be in place before states can even think about reopening. And we started by asking what he thinks about the president saying that there are some states that could lift stay-at-home orders even before May 1st.
I'm certain, though, even though I haven't specifically discussed this with him, that he's talking about some of the states that have a very low level right now, particularly those states with a low density of population and a lot of geographic lands.
Yes, but in any event, can you think of any state that would be ready to do that, lift those guidelines before May 1st?
You know, I haven't gone state by state through them, except to say, Savannah, that I do believe he was referring to those. And there is going to be a great deal of variability. It probably would be a rolling entry into it, with some states actually doing nothing different because they're still in a really difficult situation and you would not want to relax any of the physical separation guidelines, and others that would be doing really much better. So it's not going to be a one-size-fits-all.
And with understanding that every state, every country, every region, every community is different, what in your mind are the absolute musts, the absolute prerequisites that any community, state, or region must have in place in order to lift these mitigation guidelines?
Well, that's a great question, and we have discussed that many, many times. And the minimum thing is that you've got to be able to identify, isolate, get out of circulation, and do adequate and appropriate contact tracing as new cases arise. If you start pulling back on mitigation, physical separations, there will be infections. The real proof of the pudding of the success of this reentry is how quickly and effectively you identify them, you get them out of circulation, you give them care where needed, and you do contact tracing so that you don't have a beginning of a peak. If you don't have that, then you may have some difficulty, and that's what we're concerned about when we tell people what they really need to have in place.
You told the Associated Press earlier today we're not there yet in terms of the testing and tracing necessary to contain new outbreaks, which of course raises the question, how far away are we from getting there?
You know, we're rapidly approaching. If you look several weeks to a month ago, the number of tests were out there. Right now, there are, I believe the last number that we spoke about the day before yesterday or today was close to or even at or beyond 3 million tests. That's really far, far greater than what we were a couple of weeks ago. Right now, they're developing the capability of even escalating and accelerating that even more, so that we would be able to have a significant number in the measured in the millions of tests each week.
I mean, what do we know about whether you do develop immunity to coronavirus? I'm sure you saw this report that came out of Korea from their CDC saying that they had found the virus had been reactivated in a number of patients they thought had been cured. What do you think about that?
We don't know how common that is. It's likely an uncommon event and won't have a public health impact. We have to be humble and modest and appreciate that we don't have all the answers with the antibody, because the things that we don't know is that in general, with viruses that we deal with all the time, when you develop an antibody after infection, it almost invariably means you're protected. We don't absolutely know that for sure yet. I think it is going to be the case. I can say I think it will be. The other thing that we don't know is the durability of protection. So are you protected for a month or 2 or 3, a half a year or a year? We need to get experience to know that.
Finally, as you know, New York has been hard hit. The governor has said recently that he believes, looking at the numbers, that there's been a plateau, that perhaps it's on the decline, and that the worst may be over. Broadening that out to the country as a whole, do you feel, as we sit here now, that the worst is behind us?
Right now, given what we are doing, the worst looks like, for the most part, with a couple of exceptions, there's still a couple of cities right now, Savannah, that we're worried about that haven't yet peaked and turned around. But if you look at the New York metropolitan area as kind of the prototype that's been driving this through the country, and then look at the country as a whole, there's no doubt what we've seen over the last several days is a flattening out. And even when you get to New York, it's actually starting to come down regarding admissions, hospitalizations, needs for intensive care and intubation. Hopefully that trend will continue. So, as I say, I'm a very cautious person, but we are seeing some light at the end of the tunnel.
I think I almost heard you say, perhaps the worst is over, with many, many caveats.
Sorry, Savannah.
Thank you, Dr. Anthony Fauci. Thank you very much for your time. We really appreciate it.
Always good to be with you. Thank you for having me.
You can't blame me for trying. I think we all are just waiting for Dr. Fauci to say, yes, okay, the worst is past, but he will always tell the truth.
And by the way, that's the first time I think I've seen him laugh, and I like his laugh.